Thank you so much, Tanya, and thank you for having me here today. It's a pleasure being here, and I think Sunday or Monday doesn't matter the day of the week. Speaking about policy is always exciting, right? Or at least for people who are in this space. Great. So let me do one thing. I know I have 40 minutes. I'd love to kind of speak for about 20 minutes or so, and then open it up to any question and answers. Or if I am kind of going over big concepts very quickly, then if you can stop me and feel free to just ask questions as we go along. I'm going to go ahead and assume that policy understanding in this for this audience is relatively basic. So let me just start with the fundamentals of Indian policy. Actually, let me take a step before that and kind of briefly introduce my background and how my work kind of approaches public policy. So essentially, I run a social enterprise called Swaniti Initiative. And what Swaniti does is it provides technical assistance to state governments and to members of parliaments on public service delivery. Tangibly, what that means is that when it comes to public programs, we work with different governments at different levels. So it can be at a district level, a state level, and in few occasions at a national level, to help them think through what the gaps and opportunities are with different public programs and how to overcome them. With that context, today I'm hoping to kind of break down public policy from that perspective as well, and address it from how do you go ahead and deliver public services as a government agency, and then what are the different stakeholders who are engaged, and what does a public service kind of delivery finally look like. So if you were to kind of take a first step, what is that the government is committing to do? One of the big things that the Indian government particularly commits to do is to provide what is called broadly a gamut of broadly public services. So what does that mean? That means that through something like RTE, all Indian citizens are promised access to education. We also have a healthcare for all, which is why we have centers like public health centers or community health centers, PHCs or CHCs. Similarly, the government doesn't promise employment, but through things like the Employment Guarantee Act, MG Narega, it does ensure that those who are supposed to be under poverty line have at least 100 days of work. So very broadly across different sectors, whether it's education, whether it's health, whether it's employment, the government has increasingly committed to delivering what is public services. Of course, in addition to this, the government has other areas where it works on infrastructure development, and clearly law and order and armed forces are a huge part of the government as well. But given my work and my background, I kind of wanted to get into the more human development side of what state governments, central governments, and district governments commit to do. So given that the gamut of work essentially for government right now on public service delivery is in these three areas, the way that a government promises to deliver this is through what are broadly known as schemes. So we all have heard of different government schemes and programs. You've heard of Beti Bachao, Beti Padhao. You've heard Sarva Shiksha Abhiyan. These are broadly government programs which are introduced to make sure that all of its citizens, and in India's case, particularly its most vulnerable, have access to. Now, if you were to kind of bifurcate who the different government stakeholders are, the broadest way to do that is to look at it from like a central, state, and district administration perspective. So from a central government perspective, what you'll notice is that mostly, whether it's through parliament or whether it's through different ministries, a central government will give you a broad overview of what they expect the different state and district governments to do, what they expect the country to do at large. So for example, the MG Narega Act, which is the 100 Days Employment Guarantee Act, broadly what it does is it tells everyone that, look, whether you're any state government you have to make sure that all people who are living under poverty line have at least 100 days of employment accessible. And the way that you do it and what kind of works that you pursue and how you're going to enroll poor people into this program is at your discretion. So what this tangibly means is that you essentially have a broad guideline set out by the central government on how to accomplish something, right? So MG Narega is one example of that. Recently, if you might have seen in Parliament, there was something called labor codes which were passed. This included providing social security to people who are migrant workers. What does that mean? That basically means that the central government came in and said, look, state governments, doesn't matter what state government you are, you need to go ahead and provide social protection to all migrant workers who are coming in. So basically, again, coming back, taking a step back to what we were talking about, the central government's role very broadly is what is the framework that a state government needs to follow to deliver what are public services. Now, public services in this case is about social security to migrant workers, like we talked about, or 100 days of employment guarantee. Or a few months ago, if you might remember, the Prime Minister announced healthcare for all. So we have Ayushman Bharat, which was introduced a few years ago, which is making sure that all citizens have access to healthcare and healthcare insurance. So you're able to kind of get basic facilities if you are unwell. So the national government's role is to broadly provide frameworks, which then go to state governments. Now, what a state government ends up doing is taking that broad framework and operationalizing it. So let's take that example of migrant workers again. Now, central government has gone ahead and said, you're supposed to go ahead and make sure that all migrant workers have access to social security. What that social security will look like is also defined in the act. But now going ahead and operationalizing it, i.e. who will enroll, how will they enroll in this, how do you make sure that the parameters are fair? One of the things that this bill has essentially done is give that discretion to the state government, is saying, why don't you guys set up a panel and figure out who should be enrolled and how the enrollment process should look like, and then who will ultimately end up how will you measure ultimately disbursing the benefits. So that's something which becomes a state government's responsibility. In the case of the MG Narega Act, it becomes also, what kind of works are there? So now the central government has told me as a state, I need to provide 100 days of work. I as a state government might say, it makes sense to go ahead and to actually have workers plant trees, which is, for example, what they're doing in Jharkhand, is plant trees in forest areas. And that is something which is useful work for us, and something which is, whether it's an unskilled or a semi-skilled person can do. And that's great. So let's do that. That is most beneficial to me. So Jharkhand will go ahead and introduce a program like a Gram Harit Yojana, where they'll take the MG Narega workers and essentially go ahead and say, for the next 100 days, y'all are going to go ahead and plant trees. And that's what's been happening. So, a state government's role ends up being to operationalize a framework that has been put forth by the central government. And that's something which is, really kind of powerful for state governments to be able to shape and to structure things that work to its advantage. With that being said, once, you get, let's say, a state government that now says, I've been able to go ahead and to create these frameworks, it comes down to the district to operationalize those frameworks. Sorry, there's a question. Let me just make sure that the question is answering. Is there a system of checks and balance between state and central government if there's a policy implementation? Can center interfere with policy implementation by state? That's a very good question, Shifali. So, the question is there a system of checks and balances with state and central government? So a lot of the frameworks, if you notice, whether it's MG Narega, a lot of the money, if you notice, actually comes from a central government. So one of the major ways in which the checks and balances works is, I'm supposed to spend 10,000 crores which have come in from the center to be able to address this scheme. The central government, the state government, whether or not it's been able to effectively execute it or not, one of the parameters of checking this is how much money have you spent. When a central government also lays out a framework, typically it lays out some sort of monitoring some parameters as well. So the central government will ask, how many people have you employed last year? What kind of works have they done? In the case of MG Narega, they'll also check what kind of assets have been built, and there has to be proper reporting. So there is definitely a reporting between the central and the state government, and fund release is dependent on that. For example, recently though, there has been a lot of discord between, let's say, the West Bengal state government and the central government. And so the Bengal state government has essentially said, we're not going to do this. We will just not execute on programs. And in some cases, the way that the central government can penalize the state government is by saying, I'm just not going to release your money after this. The other weird thing that some state governments do, well, it's not weird, but the other thing generally that state governments do is they might take a central government scheme and they might just rename it to something that they want to name it to. So, they're basically doing the same thing, like a housing scheme, Awas Yojana, but it's been renamed under the central government gamut so many times that you will kind of see the same mission being accomplished, but political economy dictates that it becomes very localized. Your second question is, can center interfere with policy implementation by state? So I would say about 15 years ago, that used to be 10, 15 years ago, that used to definitely be the case. The one power dynamic which has shifted significantly in the last few years has been the amount of funds that a state government contributes to any scheme. Now, typically it used to be 70% of any money used to come from the central government and 30% used to come from the state. That dynamic, that number has shifted and really kind of changed depending on the scheme and the program. And because that dynamic has changed, the state autonomy has increased a lot more in the last few years. When it even comes to allocation of funds, the state government is increasingly having autonomy in calling the shots on how they want to frame different policies. So when it comes to like the center and state, there used to be, look at what happened with the agricultural bill, right? The farmers bill. You would have protests, you would have, even before, you would still have like a lot of discontent. But because economically states are being increasingly empowered and there is a lot of merit to more decentralized decision making, what you're seeing with states is that states, when they don't like something, they'll just say, I'm not going to follow you and I'm going to do whatever I want. And the center is increasingly trying to figure out ways where they can kind of come in, and if finances is in the way, how do you make sure that you still have the control or the advisory or the support that you need to provide to the state governments? And that's a power dynamic that's still playing out, given that there's been a shift in the last 15 years or so between center and states. I hope that answers your question, Shafali. But essentially, those are very good questions, by the way. Thank you for that. But essentially, what you're seeing is that even in the way that the frameworks are being created, whether it is in the parliament or whether it's in different departments, more states are being given autonomy to decide how to do things, because there's a recognition that this is something that states need to be able to have their own say in. And you kind of notice that even when the lockdown was happening in the last few months, was, you notice that initially the central government came in and said, we go by the book, this is what we do. The Pandemic Act gives the central government all the authority to call the shots. And then as the pandemic kind of eased out more and more, you had more state governments kind of having a say in what they wanted to do. And it's kind of interesting because that snippet of that window of time in terms of how that decision making moved resembles quite a bit of how, in fact, I would say the state-centered dynamic over Indian history has moved. Is, you kind of had a very strong union government that now increasingly remains strong, but in different ways, where state governments are also emerging as strong entities. With that being said, I think the one very important stakeholder, which we sometimes often overlook, is the state-district dynamic. So again, since we're on the example of the pandemic, one of the things which you might have seen was how important districts had become in decision making and in terms of actually executing on this. So what is really interesting is that when it comes down to execution, that is kind of one of your stakeholders, and Gram Panchayats then subsequently below, but certainly districts are a major stakeholder, where especially for a state government, if there's a program which is coming in, any program which is coming in, it ends up being the district who executes these programs. So whether it is, let's take Ayushman Bharat, everyone's supposed to have healthcare insurance. As a district administrator, I'm supposed to go ahead and make sure that everyone is enrolled in these programs. So as a block health officer, I'm supposed to go out and make sure that everyone who is below poverty line, has a certain income level, has access to insurance card, has access to Ayushman Bharat cards. And this is where I think a lot of capacity needs to be built, in my opinion. When it comes to districts, the while the onus of execution lies on them, there aren't as many human capital support pieces, and b also course corrective measures. So if you notice a lot of reporting, again, Shefali, going back to your question, accountability between state and center. So when a state government reports and says we've been able to distribute 1 lakh Ayushman Bharat cards, the way they are getting this data is actually districts are going out and doing the enrollment and then reporting it to the state. But currently, if you look at from our district to a block kind of breakdown, the technical capacities to monitor, to get that feedback, to make sure that on ground work is happening, is kind of falls quite a bit. There's quite a bit of gap between the capacities of a state government versus a district government. And it's interesting because what you saw during the pandemic, what you saw during the COVID-19 lockdown, not the pandemic but the lockdown, was that the districts were the last mile delivery kind of mechanism. So they were the ones who were really kind of trying to flatten the curve, make sure that lockdown was adhered to, make sure that patients were getting treated. And it really highlighted the need for us to build the capacities of districts by having either more officers, b more kind of knowledge support, c more capacity building. So these were kind of things, we focus so much on from state to center, from center to state, but then the translation from state to district also needs to be that effective. Our own work at Swaniti has been quite a bit at district levels, and what we've noticed is having even a team of 6 or 8 people kind of working with the district magistrate's office, working with the health officer's office, working with the education officer's office can really have a huge impact, because that execution, that operationalizing of distributing Ayushman Bharat cards or making sure that schools are functioning properly, is just very, very powerful. And some states, not all states have that gap. So some states, like let's say Andhra Pradesh, has very good district administrations, and therefore they've kind of been able to really make progress on a number of health, education, employment indicators. And so the health, I would say, overall of a state is really measured by the capacities of a district and how they're able to kind of deliver those services. So breaking down, kind of again summarizing a bit of how policy right now works, is the government essentially commits to providing some level of health, some level of education, some level of employment support in different forms. This has also been stretched to, let's say, women's security, including things like Nirbhaya Fund in Delhi, or kind of, again, Beti Bachao, Beti Padhao, I spoke about that briefly, again, would broadly fall under gender, introducing these programs and schemes. Within that, the central government kind of provides the national framework of how do you go ahead and fulfill this mission. How do you go ahead and make sure that this is fully executed? So if, for example, the Indian government said, we want to make sure that we root out hunger, and this is something which is completely removed, then the national framework for that would be like a midday meal program where they're making sure that child nutrition is fulfilled. This goes down to a state level. A state level looks like at a midday meal program, says, okay, let's introduce this in schools and Anganwadi centers. Let's go ahead and make sure that wherever children actually go to attend, any kind of education capacity, or where actually children just go, we are able to provide these meals. And so the states kind of operationalize that. And then from there, it becomes a responsibility of the districts to make sure it's executed. And districts really are like, okay, if I'm again in the office of a district magistrate, or in the office of like an ICDS officer, I'm going to make sure procurement is happening on time, that schools are actually getting the meals that they're supposed to, that children are being fed, and that overall nutrition is at the status that it needs to be. And so these are kind of like the 3 levels broadly at which policy is developed and then effectively executed. I hope that gave a larger view. I'm happy to answer any questions. I'm also happy to kind of share how our own experiences of working in this space. But I'll pause for a minute and see if there are any questions, anything I can help answer.
Thank you, Rwitwika. Yes, so I was listening to you to very insightful details of how you explain the entire domain. Guys, if you have any question, now is the perfect time to start asking. So yeah, we can take up more questions if you have any, or you can, in the meanwhile, Ritvika, you can talk about your own experiences at Swaniti and how you have experienced this application of policy cycle and effective governance,
Sure,
how that has
absolutely.
been. In the meanwhile, if there are questions, you can take them up surely.
Sounds good. Great. Yeah. So, I think when it comes to our own experiences, there are kind of two pieces that I'd love to highlight, and kind of experiences that we've seen really work. Let me start with the kind of state level work that we've done. So, while we kind of talked about broadly about sectors and talked about health or education, there are also such significant kind of horizontal thinking, which is required kind of as you're thinking through governance. So one of the things which we worked about, I'd say 2-3 years ago, was in the Northeast. We worked in Manipur and Tripura on direct benefit transfer programs. So for those who don't know, one of the things that the government did a while back was to say that, it's best if someone is deserving of certain programs or schemes, if they require cash transfers, and kind of India went to this model of providing cash transfers to the most vulnerable, then the best way to do that is by doing a direct transfer to their bank accounts, which is known as DBT. So it's known as direct benefit transfer. And this is something which is prevalent across a lot of the schemes that, I briefly touched on at the beginning. This is kind of applicable to a lot of schemes in the Indian context where you focus quite a bit on DBT. So DBT is like very critical to making sure that, the schemes and the benefits that the poor really kind of need are getting there. While we're speaking about education or health, it's important in the governance domain to also make sure that key systems to be able to deliver these are also sound. So 2 years ago, when we were working in Manipur and Tripura, the Northeast, interestingly enough, is identified as being weaker in having strong DBT channels. And if you're not able to make sure that the poorest of the poor have the money in their bank account to access basic programs, then kind of defeats the purpose of having social security. And so what we did was work with the Manipur and Tripura state government to be able to see why certain gaps existed and how do you help overcome these gaps. And so, the Northeast, clearly, while they're incredible in certain indicators, being able to have an effective census and being able to see the number of people who would be the beneficiary and objectively assess whether that's the right number or not is one of the limitations that does exist. So what we ended up doing was actually working with the Northeast government to then go in and take in, let's say, 2 or 3 key DBT programs, and through those DBT programs understand why is it that these gaps exist. So for example, we took a program, the Awas Yojana, which is the housing scheme, and we noticed that there were significantly fewer number of enrollments, and essentially try to assess why there are so few enrollments in a program like this. And what we realized was, for a beneficiary who wanted to build a house, and the government, again, one of the schemes that the government promises is to the poorest of the poor, the Indian government says, we will give you the funding to build your own house as long as you're willing to put in the physical labor to build that house. So under the Awas Yojana, because Tripura had so few, when we assessed, we noticed that there was something very funky happening. There are 3 payment tranches through which you actually get to build your house. So you get the initial down payment, then you show that you've built X amount of the house. Then you get a second payment, which is for about 75% of building the house. And then you get the final payment. And we noticed that there was a huge dropout after the first tranche of money coming in. And that was because reporting how your house was being built and whether or not you were making progress or not was very complicated under the Awas Yojana. And so it was harder for the poorest of the poor to come in, have someone there, take a picture of how well your house was built, go back, report, put in the paperwork, make sure that there was adequate follow-up happening, and then get the money for those schemes. So a lot of people just kind of figured, they've built what they've built and it's worked out, and they'll probably live in whatever has been built and they're fine with it. And so what we end up kind of doing was trying to figure out with the government, how do you simplify this process? How do you go ahead and make sure that enrollment in these programs is easy, but then the subsequent tranches of funding which are supposed to come in is equally at ease? And so one of the big gaps that you'll notice tangibly on ground when we talk about these schemes and programs is, how do you make sure that access to these programs remain as, as easy, efficient, and yet there are the monitoring and oversight tools which are required, which are there, so that the beneficiaries end up getting access to those schemes. So that's one example of the kind of work that we've seen, the kind of gaps that we've seen on the ground, which have really kind of emerged. Notice that there's a question there as well. So this is from, so I'll just jump to the question. This is from Swarnima, which is COVID-19 has significantly redefined the sense of good governance. It has also highlighted the importance of systemic enablers for better and inclusive governance. What is your take on the same? Do you think COVID-19 is a powerful nudge towards humanizing governance? Swarnima, this is actually a really good question. When it comes to governance and government, what is remarkable about COVID-19 has been, at least for someone like me, was the realization that a government is just that powerful to be able to shut down an entire country within the scope of 4 hours, I think, and a country the size of India. And, being in the governance field, I think you realize that it's kind of important, which is why you're there. The extent of the power, though, I think was fully flexed in March, I would say. I have never kind of really realized, and you looked at the US, and the US didn't shut down the same way that India went into an aggressive lockdown. And it was fascinating to someone like me to realize how powerful and how omnipresent the government is, and how, especially in India, you can't escape the tremendous influence that a government has. So in the West, where you have a lot of arguments about big government and small government, in India, you saw it is a big government. It's everywhere. And it is, I think even today, it continues to kind of be able to flex its muscle, unlike any private sector or civil society, even a collective unit of that can do. So I think that's really fascinating. Your point about humanizing is really kind of interesting. One of the things which we have grappled with, whether it's at Swaniti or as individually, is the kind of top-down feedback that continues to be there in government and governance. And this is not just a central government problem. I think this is a local government problem as well. So the Indian government has, especially at a district level, our local governments have the capacity to have pieces like participatory budgeting, have local town halls, be able to kind of really bring people together in groups and have those conversations for a bottom-up planning and for like a humanizing of being able to get more feedback on what people and citizens are thinking. What I think we're not very good at is across India being able to have very robust systems to do that. So for example, in West Bengal, you have very strong Gram Panchayat systems. In Kerala, you have very strong Gram Panchayat systems where communities are able to come in and govern collectively and make sure there's a larger good that is being met. Unfortunately, that doesn't translate into all of India. And I think what COVID-19 kind of highlighted was that you had a central government which was kind of initially pulling out blanket statements for everyone, and being able to have those kind of, seeing that, you kind of realize how our bottom-up processes are still not there as strongly as they need to be. I think it was possibly by the third lockdown that they had, that the central government was really actively seeking the feedback of district administrations. But before then, it was mostly a top-down process. And part of the argument from a central government perspective is when you have so many stakeholders, when you have 600 plus districts, when you have 543 plus elected representatives, how do you grapple with that number? But I think the problem is not just of number, but the fact that we also haven't systematically created the capacities to cater and to break down and say, Maybe someone handles only West India and gets bottom-up feedback. Maybe someone handles only East India. And we haven't created those systems even after 70 plus years of independence to have that bottom-up governance, which would humanize and really kind of take that feedback. So Swarnima, I hope that that kind of answers your question, but your point is very valid. I think COVID-19 overarchingly kind of put out in front the issues with governance which are broadly there. And I think it's a great opportunity to try and at least fix a few of those. I saw a few questions. So I'll start with Sagarika, and I know we have about 7 minutes left. So Sagarika, you asked, what are the guidelines central government used to frame the policy? Like given the number of states is huge and each of them have their own interest. While checking effectiveness of policy, are there any metrics which are compulsory to be maintained by state government? Also, when a state government says it doesn't want to follow, does the state government come up with reasons why it wouldn't be doing and propose any alternatives of their own? So these are quite a few questions. Let me just start with the way that the central government comes in to frame policies. So typically what ends up happening is that the central government will end up taking feedback from state governments. So if we were to, for example, take that Midday Meal Act, which came out. So interestingly enough, Midday Meal actually emerged from Tamil Nadu. So if you look at the history, MGR in Tamil Nadu was actually one of the first chief ministers who himself, was raised in quite a bit of poverty. And one of the things that he said was, I don't want other children to go through what I did. And therefore, it is important that they get fed at least one meal a day. And I believe he started working when he was very young because he came from such a poor family. And so the central government then essentially said, Tamil Nadu, you guys have a really good model. Let's pick this up and let's make this national. And so a central government will end up at that point taking a lot of feedback from other central states and saying, what do you think of this? This might happen through a letter. This might happen through a debate in parliament. This might happen through parliamentarians' feedback. This might happen through standing committee feedback. There are different mechanisms through which a central government ideally should take feedback, and 9 out of 10 times it does, and then develop a policy. And there are often conflicts. I mean, again, the Farmers' Bill is a great example that, you had states in the east or the south who were like, cool, that sounds fine to us. But then you had North Indian states who were like, no, this is no good for us. And so you end up kind of having some level of conflict, but optimally, much like the labor codes, there is the flexibility of how you want to frame it, which a central government ideally puts in place so that the states have flexibility. Now, in terms of the checking the effectiveness of the policy and any metrics, most of the times they kind of create broad matrices. So a central government, most of the times will say, you need to report on how much money you've spent and what kind of how many people have enrolled in the program. Most of the metrics are actually very output focused if you look at it. And they're very much like, okay, what did you end up delivering? And so did you, in midday meals, how many meals did you deliver? How many schools are enrolled in this? So those are the kind of things that a central government mandate that a state government actually maintain. And these are when you get the money, then the state government is then mandated to report on those matrices. And then, when a state government doesn't want to follow up, it just depends on the state government and it depends on the chief minister. So, you had Mamata Banerjee who was combative and who was like, I don't care, I'm not doing half the things that the central government asks me to, and I'm going to reframe them and do it my way. And so she was vocal and she's been forthcoming, and there's been a lot of issues between Bengal and between the central government. And so in that case, you have a vocal chief minister. A lot of times though, chief ministers are just kind of quiet and just kind of back things aside and not want to do it. And there isn't really a lot of question. And, they just kind of do what they want to do. It doesn't make it to the news, but it's just kind of backroom talk, which is figured out. So Sagarika, I hope that answers your question. I did want to get to Akshat's questions before we close. So Akshat, you asked, do you think that the government is becoming too centralized every year? Demonetizations, lockdown. Is this a socialist overhang? What is the solution here? Public institutions play an important role in decentralization, but it's losing its relevance and goodwill too. So I think, what's interesting, again, this is my opinion, and certainly not a study. I think what we're seeing in the last, 6 years now, is that you have a very, very prominent central government leader. Essentially, I'm talking about the Prime Minister. You have a very strong leader at the center, which is something which is followed after decades of governments which have been alliances without having as strong and as a prominent leader within the central government. So think of it this way. After Indira Gandhi, when was the last time you had a prime minister who won an election on the campaign of re-elect me? Right, that presidential style of movement is something which is relatively like, we haven't had that in a while. And what we're seeing, the result, I think, a demonetization and a lockdown, is that when you have the dynamics fundamentally shift to that nature, then you will have the demonetization and the lockdown and a very centralized government. What is interesting is that from an optics perspective, I think there is a lot more of a central government presence. But then if you start breaking it down to a state government level, you'll start noticing, no, but state governments also are kind of becoming more vocal, right? So think of it this way. Right now, one of the things that the Delhi government said they wanted to do was start penalizing. I think Kejriwal came out last week and said, we want to start penalizing Haryana and Punjab for the stubble burning, right? And now you have a state government who's saying, I want to go after other states. So you start seeing that, if the central government is becoming prominent, which I think relatively they are in absolute terms of state central dynamic, states are also equally becoming more vocal. You start to notice that states are also not leaving any stone unturned. And that to me is just really fascinating. I think the socialist overhang is a really interesting policy, but I'd strongly recommend, I know we're short on time, but I'd strongly
Ritvika,
recommend,
I'm so
if you get
sorry.
a chance,
Yes.
read Indira Gandhi's file.
Yes,
I'm done.
yes. So thank you so much, Ritvika. Thank you so much, and that was a very insightful session. Brilliant. I think you had some very good insights to give all of us on how policy works when we're talking about different governance structures. Thank you so much for joining us today once again.